It is my honor to introduce our moderator for this session, Mr. Fredrik Deputy Head of the Mission of the Delegation of the European Union to the Republic of Korea. Please join me in giving him a big round of applause.
So it's okay. Thank you for introduction. Sorry. So yes, Fredrik, I'm the immense pleasure to be the moderator today of the second session. I am Swedish, but here I am in my function as a European civil servant representing 27 member states that I'm proud to serve. I think that this session is extremely pertinent as the whole conference. Now we know that for strong countries to exist and to address tomorrow's and present challenges, you need strong and vibrant social civil societies, and this is their turn to come to the forefront today. So I am very, very proud here to have a series of very good speakers whom the most of them I met yesterday for dinner and had pleasant exchanges with. First, we have Mr. Vira, who is the Executive Director of HelpAge Cambodia, and he will speak about civil society and the human rights of the older persons in Cambodia. And then, direct afterwards, we will let the word to Ms. Eva Sabono, who is Executive Director of Yayasan Emong Lansia, Indonesia. Very difficult for me to pronounce as a Swede. And she will talk about the well-being of current and future older people in Indonesia. Third, Ms. Emily Beridiko, Executive Director of the Coalition of Services of the Elderly in Philippines. She will talk to us about advancing older persons' human rights in the Philippines, the role of civil society organizations. Directly afterwards, Mr. Sawang Kaewan따, I hope I pronounced the name right. He is the Executive Director, Foundation for Older Persons Development in Thailand. And we will hear about the Thailand human rights of older persons and reality. I think that we are looking forward to some really interesting conversations and presentations. So it is now my immense privilege to give the word to Mr. Vira.
Thank you, sir. Thank you, sir. Good afternoon, distinguished guests and participants. My name is Vira. I'm very delighted to be in the forum today to speak about the role of civil society and human rights in Cambodia for the older people. So my presentation will cover four main topics. The first one, I will present about the aging mostly about the statistics and data in Cambodia, and secondly, the key issues and challenges of older people, especially around the rights. Third, about the work of HelpAge Cambodia as the civil society organization in Cambodia, working especially around human rights. And last, we will also present about our work, our engagement with the Cambodia Human Rights Committee. So, looking at the aging population in Cambodia, starting from, according to the Cambodia Census 2019, Cambodia have 15 million people, which 51% are women. And we have 1.3, nearly 1.4 million older people, equal to 8.9%. And the figure is projected to be increased to 1.9 million or 16% by 2030, and also 5 million or 23% in 2050. So it will bring Cambodia to the very aging society as well in 2050. If we look at the life expectancy for Cambodia, women have 76 years old, 76.8 years old, over men who have the life expectancy only 74.3 years old. And we also have in terms of the population, older people population, because Cambodia defines 60 years old as the age of older people, 60 years old plus. So 6 out of the 10 of older people aged between 60 to 69 years old, which is the young age. So a lot of population, older people population aged between 60 and 69 years old. We look at the Global Age-Wise Index 2025, which was conducted by HelpAge International. We found that Cambodia was not in the good position in terms of the older people, especially around the supporting program. We stand in the rank of 80 out of this 96 countries, and income security is the main issue. We stand in the rank 91st out of the 66 country, and then it's followed by the capacity, and we can also see what are the global age-wise index as about, and also what are the domain and the indicator that was defined. And you all can also find more information from HelpAge International website. Looking at the issue, I think actually the issue of older people in Cambodia is not very different from the other country in Southeast Asia. However, there are some to highlight to you that we have. Firstly, we have a limit policy implementation, and those government have made a lot of effort in developing that. But in terms of the implementation, we can see that there are a lot of more to do. Good culture of respect and care. This is actually good, but it's also have gap and also the challenges that can hide, some kind of policy, because with this culture, older people care are seen that it is the responsibility, the obligation of the family, so that with the Vira, it has some of the limit in terms of providing the support, and also with the change in the economy, the urbanization that change the family care structure. But we still keep saying that older people are cared by their family. Income security is one of the main, as I show in the previous slide, that in terms of their opportunity to find job, their skill, access to credit, and pension. In Cambodia, we do not have a universal pension for older people as well for the moment, so that it costs older people to live depend on their family support. So we have a research and found that a lot of older people are living with the support from their family. So by this, it creates a dependency, and also older people have no dignity and autonomy in decision making in what they want to do. The health health and access to care services is also the challenge. We do not have a universal health coverage for older people, and they have difficulty to access healthcare facility also, as it is far, and most of the older people are living in the rural and remote area. Another important thing is that we have lack of specific program to promote and support the older people. The specific one we have, especially the scheme as shown by our Thai department. Yeah, I think that there are a lot of scheme and good, but we do not yet have this. Discrimination is also reported and also abuse. And another important thing is that they are not aware about the issue and the right, and this cause we cannot hear, we cannot find the problem. People are not aware about the right issue, the right issue also. So this is what we do. I will try to speak quickly. We HelpAge Cambodia was a part of HelpAge International Country Program in 1992, and we localized as the local organization in 2012. And we are currently working in 9 provinces out of the 25 provinces of Cambodia. And we have a vision that older people can lead a dignified, active, secure, healthy and secure life. And we focus, we are supporting around 240 older people association, and with around 20,000 members. And we also support older people to create a platform that they can mobilize their voice and present their voice. We call Cambodia Aging Network. We have the member in 14 provinces in Cambodia. So what we do, we support the older people association as their older people self-help group. So we organize their group, we promote their participation, and also help them to provide service to the member as the older people. We also have care and health and care support program that we focus on health promotion, health education, health care, and also include the home care services that I think we have adopt and learn from Korea model through the coordination and support from HelpAge Korea a decade ago. Income security as one of the main issue of older people, so we provide age-friendly livelihood support, include skill training, microcredit access, rice bank, cow bank, and also we have the support on protection and promotion around the climate and disaster reduction. We have another important program is on policy advocacy that it's include doing or facilitating the research, supporting the Cambodia Aging Network platform. As I said, it's about the voicing platform for older people. We provide policy input and promote the age awareness, include ageism and the rights and entitlement. Recently, we have support older people through our social enterprise initiative so that they can access to market for what they have produced on their livelihood activity. So these are the photo that activity photo that you can find that how older people association in Cambodia being supported or so they have a various activity include meeting, gathering, and addressing the issue related to climate and disaster, natural disaster. And these are the activity around our our advocacy work that we during the pandemic we support older people association to mobilize the members to access to vaccine, COVID vaccine, and also government cash transfer program, and also conducting the other the age demand action events and the ageism, how to say, the age discrimination day, the World Elder Abuse Awareness Day that we conduct every year with the older people and with the students so that they can know about the issue of the older people. So this is our also activity that we support older people to express their concern and the need in the UN Open-ended Working Group in New York in 2018, and also supported the joint action with a global network on the draft of input for new convention on the rights of older people. So these are the our activity, our engagement with Cambodia Human Rights Committee. As you can see that we provide training. We support, we work with Cambodia Human Rights to provide training, provide opportunity to older people to voice and dialogue, and also networking and communicating. And these are some series of activity that we have been doing around that, which including the introductory meeting. We provide opportunity for older people to have to meet the Cambodia Human Rights Committee. I put the wrong word, not NCHR, but CHRC. Yeah. And also they have opportunity to meet, to dialogue with the Cambodia Human Rights Committee, the senior minister in 2021, and also a series of training for older people. Unfortunately, this kind of training awareness raising is can only provided to older people association. So, but many older people are still not aware about the issue about their right. So there are some engagement activity that we do in 2022. So key result that we have, this is a final slide that with the Cambodia Human Rights Committee, we have established and create a relationship for older people and the Cambodia Human Rights Committee. They increase the understanding on human rights and issue and the issue both, especially for the Cambodia human rights. They also have again more insight about the issue of older people. But at the same time, older people have learned through the training from Human Rights Committee on the rights issue also. And one important and very interesting point is that we gain the commitment to support and participate in the law, to have a law to promote and protect the older people, both with Ministry of Social Affairs and also with the Cambodia Human Rights Committee. But the detailed action need to be further discussed and prepared as a plan. So that is the end of my presentation. Thank you.
Thank you so much, Mr. Tum. I think that there will be plenty of questions to you afterwards, but I will leave the word directly to Ms. Sabdono to make her presentation.
Thank you. Distinguished guests, ladies and gentlemen, good afternoon. And most of all, thank you to the organizers for inviting the CSOs and NGOs to this meeting, because from the government point of view and the NGO's point of view regarding the rights of older persons, it might differ, but it is good to meet here so we can share our experience and hope for better policies and programs for the well-being of older persons. So, like my presentation, I called it Well-being of Current and Future Older Persons in Indonesia, a Human Rights Perspective. As mentioned already by the chairperson of the Human Rights Commission, Indonesia is an archipelago, and we consist of more than 17,000 islands. If you don't believe it, you can count it yourself, okay? We are the fourth most populous country in the region, Asia Pacific, consisting of 38 provinces and more than 83,000 villages. So when you want to implement a program or policy, is not that easy. The total population last year, or in 2023, was about 273 million, and older persons almost 30 million. So in percentage, maybe lower than the other Asian countries, but in absolute numbers, we have the highest numbers of older persons in this region. Well, now it is the trending topic, aging population. Why? Never before in history have so many older people been living at the same time as life expectancy globally, including in the region, is increasing. In the period from 2000 to 2050, ASEAN will see a 430% growth in the number of older people, and the proportion of over 60 will triple. Therefore, it is imperative that the rights are realized for this region to achieve inclusive development and an equal society. Although human rights legislation exists in ASEAN countries, notably the Universal Declaration on Human Rights and the ASEAN Human Rights Commission on Human Rights, there is no specific mechanism for the rights of older people. Ageism or negative attitudes towards older people and aging, which leads to discriminatory practices, is prevalent, embedded in society, and seen on a daily basis in employment, access to healthcare, social protection, and public facilities, not designed to address physical limitations commonly found in later life. Current regulatory framework. Indonesia has numerous legal and policy framework in place for older people, but responses to the need of older people have been fragmented across different sectors of the government. Existing laws and regulations do not yet address the legal aspect and the vulnerability of older people, nor any guidance how to integrate social care and healthcare within a system by the government. Sometimes we think older people only need social care, which is not right. Social and healthcare should be one component. Decline in functional ability is a natural process and may worsen with age. Older people, especially in rural areas, often do not receive proper social care or health care due to existing infrastructure and limited human resources trained or skilled in geriatric care. Older persons, as mentioned before, almost about 90% work in the informal sector. So they do not receive old age security or social pension, which in fact is a basic right as a citizen. Inheritance law, both statutory and customary, deny women of all ages the right to own or inherit property when their husband is deceased. The scope of existing abuse against older people, physical or emotional abuse, financial or material abuse, just like the other countries, even sexual abuse, believe it or not, neglect, intentional or unintentional refusal or failure of family members to fulfill a caretaking obligation. In Indonesia, civil society, including aging, disability, and human rights networks, have been campaigning and raising awareness to improve national mechanism for promoting the rights of older persons. We have been campaigning already more than 10 years. However, and this is important, most civil society organizations, including those focusing on improving the quality of life of older people, lack the knowledge, skills, and resources needed, which has limited their role and contribution. As you can see, we did a lot of campaigning to support older people's rights. Is existing laws being used to protect older people's rights? In practice, the rights of older men and women are not being adequately addressed or protected through the existing human rights system in Indonesia. So we have the legislation, the programs, the system, but the implementation is still a big question mark. There is still a lot of homework to be done. The continued existing of age discrimination and ageism in national laws, policies, and practice is a sign that governments have failed to adequately incorporate older people's rights into their laws, budgets, programs, and training for service delivery staff. Addressing remaining inequalities and violations of older people's rights is imperative to ensure older people can live in dignity till the end of their lives. Human rights and development should go hand in hand. Respecting older people's rights results in better development where respect, dignity, and having a say are recognized alongside material security are important factors to older people's well-being. Increased protection of the rights of older men and women create the conditions which enable them to participate and contribute to their own development, as well as that of those around them. In so doing, respecting and protecting all people's rights results in a more inclusive, equitable, and sustainable societies. Older men and women have the same rights as everyone else. We are all born equal, and this does not change as we grow older. Even so, older people's rights are mostly invisible under international law. Despite the existence of the Universal Declaration of Human Rights, older people are not recognized explicitly under the international human rights laws that legally oblige government to realize the rights of all people. With rapid population aging, the prevalence of age discrimination escalates, and so does the imperative to address the fundamental cause of discrimination. Treating older people with respect and on an equal basis with younger people creates the conditions that enable all people in society to participate in and contribute to their own development. about us, my organization. Yayasan Among Lansia or the Among Lansia Foundation is a non-profit, community-based organization established in 1996, registered with the Indonesian Republic Ministry of Justice, and our aims is to improve the quality of life of underprivileged older people in a sustainable way. What we do, we have the home care program, training and capacity building, emergency and national disaster response, advocacy with policymakers, and sponsored a grandparent program. Community network of caring for older person in the community. Just like charity, everything starts from home. So when you want the rights of older persons, it starts at home or with the older person, the family themselves. And then it goes to the community, and then to the local authority, and then the central government. So it is a network for all related stakeholders. We cannot do it alone. It's the same. We do a lot of advocacy with the government, with the academy, and all volunteers, community leaders, NGOs, partnership and services. I hope policymakers would act now in translating policy and programs into actions. So it's not just on paper. And its implementation to ensure the human rights belong equally to every person, including older people. Laws and regulations should address the legal aspect and the vulnerability of older people and integrate social care and health or geriatric care within a system by the government. In this era of population aging, future regulatory framework on human rights for older persons should include entitlement to the same rights as everyone else, freedom from discrimination, inequalities and violences, adequate standard of living, health, working conditions, and social security. In the practice of geriatric services, law, medical ethics, religious, social, and ethical aspects have a vital role. These are all rights of the older people. Allow older people to appoint a legal guardian to act and make decisions on her or his behalf in the event he loses mental health capacity. Maybe, I don't know whether you know it, in Indonesia there are now more than 1 million and increasing by the older persons with dementia. So when they lose their mental health capacity, who makes the decision? And that is still an issue that should be regulated by law. Dignity, autonomy, and participation in decision-making concerning their life. That was already mentioned by Ibu Atnika. Rights to property and inheritance rights for women of all ages. Why do women or older women have not the same rights as older men? Building capacity of civil society to effectively raise awareness and advocating for the rights of older people. We hope that the government will do that. So as I mentioned, we have been campaigning many times to support the Convention on the Rights of Older People, and this is the last picture is about age-friendly Jakarta. We involve the young and old, the community, so it's not just our organization, and it is intergeneration activity. Each year, just to remind you who are not an older person yet, or whoever is already a senior citizen, each year is special and precious. Do not regret growing older. It is a privilege denied to many. Thank you.
It's absolutely fascinating to see that with two presentations, there's a red thread and they kind of reinforce one another. It's a very powerful message that came out. I'm really looking forward now to listen to the next speaker. So please, Dr. Hamid, it's your turn.
Okay, let me start then. My sharing of this afternoon session is about the civil society human rights of older person in Malaysia, the fault lines and future directions. I'll be sharing you three issues: demographic context and importance of human rights for older person, understanding civil society in Malaysia, and civil society activities related to human rights of older person. Okay, let me share with you a glimpse of the demographic aging and the importance of human rights of older person. Because if you look at the issue at the national level, if you look at the data at the national population level, in 2020 we have 10% of the population, which is about 3.5 million, and then in 2030 you have 37 million. But if you look at the most recent population census, we have 5 top districts of population that is 60 and over. You see that Lubuk Antu is one of the districts in Sarawak where we already have over 90% of the population are aged. So you just imagine at the national statistics, it is very low, yeah? But at the regional level or lower level area, they have differences in terms of the agedness of the community. So that means there are differences at national, state, and district levels. So that has implication on services and policy making at the different level. Because if you just use the national policy making, the national guidelines, it doesn't really fit into the needs of the local level population. So we need to really think about how we should address this. And most importantly, it is also the old that is increasing higher than the young old. So if you look at the statistics that I have in terms of the 70s, 80s compared to the 60s plus, the 70s and 80s increases more than the lower ages. So that means there is a lot of room for us to address the issue, because they have survived over 60 and their survival at over 70s are much higher. So it is very important then to look at the perspective of the human rights of older person, because a lot of our countries in our region has very negative view of older persons, and because of the heterogeneity of older person, they have different needs and demands. So that means policy making is rather tough. Which are the priorities that we should address, okay? And also at the same time, we have the pace of aging. As I showed you, the national statistics and the statistics at the different locality level is different. So how do we address this pace? Yeah, because it's very different. And being a multi-ethnic society in Malaysia, we have different pace of aging between the ethnic Chinese, ethnic Indians, and ethnic Malays. And also we have the Sarawak and Sabah ethnicity, which also differs. So it is really a very complex issue for the Malaysian government to handle. So therefore, we need to reorientate our laws and regulations and policies to meet the changing demands. And we also need probably a new service delivery models to address these current needs and also future needs of the older person. Okay, and if you want to understand the civil society of Malaysia, let me go back slightly to the historical part of the civil development of civil society in Malaysia, where in the pre-independence Malaysia, we have a lot of youth organization and social organization that looks at the immediate needs of the population. But after post-independence, where we developed the Societies Act in 1996 to regulate the NGOs, and we also have in 2016, the NGOs can be registered under the Companies Act. So this registration of non-profit companies can also be done, but in a sense that the freedom of association is still very limited, yeah, and especially NGOs that are vocal about human rights and have a political orientation, they really have in terms of the activities are quite limited, yeah, in that sense. So, and of course, within the civil society organization, we have challenges in the movement in terms of the structure and internal organization issues, in terms of undemocratic work culture, irrational rules of organization, power-based culture, and underpaid staff. So how do these people perform in terms of trying to negotiate or trying to implement their services, okay? And the next aspect is about the establishment of the civil society, or the motive of the establishment of the civil society, and some of them maybe fail to understand the real needs of the problems in the communities, because mostly they get funding from funders, and maybe they just follow the needs of the funders. And of course, there is also the influx of egoist CSOs, NGOs, and in another aspect is about the size of the organization. We are very small in terms of size, and very few national organizations, and basically they are really urbanized, and the distribution in the rural areas are probably not present at all. And of course, because of that, there is an issue of sustainability of the NGO, and also there is a lack of supervision from authorities, especially in terms of financial matters, because a lot of these NGOs get support. Yeah, but in terms of the transparency, so I go to the next issue in terms of the weaknesses of CSOs, in terms of accountability, transparency, and ability to make changes because of the internal structure, and also the issues of how do they handle this beyond the borders of the Klang Valley, okay? And the civil society and human rights, very few exist in Malaysia in terms of this, and human rights orientation is negligible, and mostly these NGOs are found in the Klang Valley area, where you have KL and the capital city area. In terms of human rights action plan in 2018, we do have the Human Rights Action Plan that was developed by the legal division of the PMO's office. But if you look at the trust that has been developed, there is 5 trusts, and the third trust is where the rights of vulnerable groups. And to me, the older person is lumped inside these rights of the vulnerable group, because and as an activist for human rights and for older person, I see the biasness in terms of this. But yes, there are some parallelism in terms of vulnerability of older person and and PWDs. But in my own research, less than 4% of the older person are vulnerable. So the other percentage they are not vulnerable. So when you lump them together as a vulnerable groups, then you already are biased in terms of your strategies to address the older person issue. So I'm not going into the details of this, but and we also as activists, we don't really know what has been implemented in this the National Human Rights Action Plan of 2018 in Malaysia, because I think this came out because of the requirement of the periodic reporting of human rights to Geneva. Okay, in terms of the activity, so I'm going to narrow down in terms of the rights now. If you look at the human rights perspective, we have, I think we did it in 2004 to look at how we can develop the laws and reform for for the human rights in Malaysia through the bar councils, and I was one of the presenters at that session. And also, as Dr. Chu mentioned this morning, that we are still waiting for the laws of this, and there are key issues that is arising in the community where we have abuse and abandonment of older person in the hospitals and things like that, because the children cannot cope with the care and all that. So we are waiting for all these kinds of new legislation to come in. And in fact, recognizing the abandonment and abuse of the older person, the World Elder Abuse Awareness Day was declared by UN on the 15th of June 2011 and things like that. So because of the growth of the number of the person, there is a need for us to look at this issue. The next right is the rights to care. And then the key issues here is, as I mentioned earlier, there was abandonment in the hospitals and things like that. And care concerns have been a public priority due to erosion of traditional family support. And recently, there is a discourse of care in the context of the silver economy centered around state support for care workers and caregivers. And there are a lot of actors in this area in terms of healthcare, welfare and housing, whether it is home help service, care center, nursing homes or retirement villages. The accessibility and affordability of aged care remains a major issue, and senior living was touted as a potential business opportunity in 2012 under the Pemandu Healthcare National Key Result Area, paving the way for greater marketization of elder care today. So there is a lot of players, and these are some of the players that are working in terms of care in Malaysia. And in terms of right to participation, the key issues is the current national policy for older person 2011 incorporated the component of old age employment, suggestion to increase the retirement age to 65 after the last minimum age of Act Amendment in 2012. The government introduced tax incentive for employers hiring older workers and introduced training programs for seniors to re-enter the workforce. Traditional senior citizen clubs are joined by new entities via the Older Person Activity Centres or PAWE, wellness and lifelong learning groups, as well as other civil society groups. Nevertheless, there are still limited number of scholarship or education opportunities for the older person. New businesses and social enterprises now offer new services targeting at older consumers and their families, and major strides in the social, cultural, and economic participation of older person are in place. So these are the organizations that are providing all these services in Malaysia. And to look at the rights to dignity or non-discrimination, the key issue is Article 8, bracket 2 of the Federal Constitution provides that there shall be no discrimination on the basis of religion, race, descent, place of birth or gender, but they miss out age. So we need to put age in this article, yeah. And the most civil society organizations, especially those in the Klang Valley, play a major role of advocacy as a voice for the seniors. And a major development in the civil society space is the rise of research and development on old age and aging to support evidence-based policy making. And I was the pioneer who established the Institute of Gerontology, or now it's called Institute Penyelidikan Penuaan, or My Aging in short, to be an advocate of evidence, to provide evidence for the government to look at how we can do evidence-based policy making. And there are a lot of now organizations, especially based in the universities, to look at this issue. Next, the right to security. And the key issue is income security in old age is a major concern, and calls for social pension is persistent. Major pension reforms, however, are still lacking with pervasive views of pension as a fiscal burden. Philanthropic and CSR-based foundations have emerged in the cash transfer space, complementing traditional care and support, including soup kitchens. New financial instruments in the form of reverse mortgage has also emerged, and general advocacy groups are complemented by pensioners and retiree associations, and environmental safety and age-friendly cities and communities are being promoted. Okay, and these are some of the civil society actors on aging in Malaysia. We can divide them into lifelong learning or educational groups, the health or medical based groups. You have the international NGOs, we have the retiree association, we have faith-based organization, we have research or academic institution, and we have professional bodies and interest group that looks into aging. And of course, we have the traditional senior citizens club and other welfare or charity-based organization that champion certain issues of the older person. So the fault lines and recommendation, there are of course several fault lines as I listed here, the transition from needs-based to right-based, and to also have self-determination and decision-making capacity for the older person, and the gender gap and equality among male and female, and also across region. The other aspect is in terms of formal versus informal pension issues, in terms of coverage, sustainability and adequacy, and there is a perpetual long-term care gaps in service delivery, financing and manpower, and lifelong learning and work issues. There is a limited usage of tech-based solution, and the future direction is the state ready to perform the role. And there is also the consent and medical legal framework that we need to look in terms of the decision making on behalf of the older person. And the third issue is about life cost perspective and the cultural shifts that is needed when we talk about aging society. And we really need social protection reform as quick as we can, and to integrate health and social care together. And the long-term care reform is much needed, because the needs of the older person is very different from the present curative perspective of care. And there are limited labor market intervention and incentive to promote the productive aging of Malaysians. So in conclusion then, the HR perspective is relatively new in Malaysia, and we need to overcome barriers and structural issues of HR understanding, so that we need to have public education and awareness needed on HR perspective. The complexities of issues of older person require prioritization, and which one would be prioritized is a big question, yeah? And the CSOs on aging focuses on key issues and challenges of aging. The HR approach is peripheral, more of a special treatment request to the government, yeah? And need for professionalism in CSOs, and stakeholder approach on aging should be from the developmental perspective. And I see here Suhakam has a very integral role in spearheading the HR for older persons. Thank you.
Yet again, a super interesting presentation. I learned a lot. Thank you so much. Very structured, good conclusions. I think that anyone could hire you as a consultant. Now we are proceeding to the next speaker, Ms. Beridiko, Executive Director of the Coalition of Services of the Elderly in Philippines. Please, the floor is yours.
Yes, good afternoon, everyone. So, the title of my presentation is Advancing Older Persons' Human Rights in the Philippines, the Role of Civil Society Organizations. My presentation covers first the demographic overview and aging statistics. Second, the overview of older persons' human rights in the Philippines. Third, challenges faced by the older persons. And fourth, the role of civil society organization, which in this case, I'll be sharing our initiatives or activities with older persons in the country in upholding their rights and welfare. Fifth, collaboration and partnerships, particularly with the Commission on Human Rights. And lastly, the future direction and recommendations. So, based on the 2020 Census of Population and Housing, the Philippines had a total population of 109 million, and 8.5% of, or 9.2 million are senior citizens or older person aged 60 years old and above. There were there were more females, 55.5% than males, 44.5% among the older persons. The aging index, or the proportion of persons aged 60 years and above per 100 persons under the age of 15 years, was computed at 27.6% in 2020. This means that there is one person aged 60 years and above for every 4 children under 15 years old. In 2015, the aging index was 4.2%, 4.2 points lower at 23.4. So, and the life expectancy in 2022 is 71 years for male and 78 years for female. So, female outlive male in the Philippines. Then, for the overview of older persons' human rights in the Philippines, first, there are relevant laws for older persons in the country that include 20% discounts and value-added tax exemptions for medicines and medical supplies, professional fees, and attending physicians. There are medical and dental services with, in private facilities with 20% discounts. And for the transportation fares, hotels and restaurants and recreation facilities, social pension program for indigent older persons, and others. These laws collectively aim to ensure that older persons in the Philippines are provided with various forms of support and protection. Second, the Philippines has demonstrated its commitment to the rights of older persons by participating in various international conventions and agreements. These commitments reflect the country's recognition of the importance of protecting and promoting the rights and welfare of its aging population. And third, the Philippines has taken significant steps, as already mentioned earlier by Commissioner Beda, EPRES, to align its national efforts with international commitments to protect and promote the rights of older persons. The legal framework and policies demonstrate the country's dedication to providing comprehensive support to its aging population. Despite the Philippines' commitment to upholding the rights and welfare of older persons, age discrimination remains a significant issue. Ageism persists, affecting various aspects of their lives. Older persons often face exclusion from insurance plans and loans as financial institutions prioritize profit over service. Job advertisements frequently impose age limits favoring applicants under 40 and mandatory retirement at the age of 65 further marginalizes older workers. These practices hinder the full participation of older persons in society and undermine their economic security and well-being. For the challenges faced by older persons, we identified some. First is on the economic challenges, healthcare challenges, social inclusion challenges, and protection from abuse. On economic challenges, a significant portion of older persons in the Philippines live in poverty. Many have insufficient income to meet their basic needs such as food, shelter, and health care. lack of adequate pension, limited employment opportunities due to age discrimination, and economic dependency. Many older persons are economically dependent on their families for financial support, and healthcare cost is a significant burden for older persons, especially those with chronic illnesses or disabilities. Despite government health programs, many older persons still face high out-of-pocket expenses for medication, treatments, and other healthcare services. For healthcare challenges, many older persons, especially those living in rural or remote areas, face difficulties in accessing healthcare facilities due to the long distances and lack of transportation options. In some areas, there are limited healthcare facilities and professionals, making it difficult for older persons to receive timely and adequate care. Mental health issues among older persons, such as depression and anxiety, are often underdiagnosed and stigmatized, leading to inadequate treatment. On social inclusion, older persons experience social isolation due to factors such as death of, for example, death of spouse, children moving away. We know that Philippines, I think, is number one sending workers abroad, domestic workers, and and or limited social networks, which lead to loneliness and negatively impact mental health of older persons. Mobility issues and health problems can make it difficult for older persons to leave their homes and engage in social activities, further increasing their sense of isolation. For the protection from abuse, there are cases of elder abuse, but lack of proper reporting system or mechanism, and there is no law policy for anti-elder abuse yet in the country, and we are pushing for it since, I think, 2015, but unfortunately, until now, it's not being into law and being passed. Now I'll be sharing, I can say that maybe these are some of our good practices also, our intervention with the older persons organization. So first, the development of older persons organization, we call it OPO. Here we facilitate the formation and the strengthening of older persons organizations through capacity development, such as trainings, workshops, and the establishment of community-based programs of older persons according to their needs and capacity. So these programs are managed by the older persons themselves. Second, through advocacy and lobbying, COSE pushes for the enactment of legislation that promotes the rights and well-being of older persons and calls for the better implementation of existing programs and services. We have, in the Philippines, we have good policies and programs for older persons, but the problem is on the proper implementation. So with our advocacy and lobbying, some of the gains that we already achieved, like the social pension program, the mandatory field health coverage for older persons in the country, having now the National Commission of Senior Citizens, and others. No? We have other. Then for the next is the promotion and establishment of community-based healthcare services that include mobile healthcare services and home care assistance program. By the way, as already mentioned by Vira and Ma'am Eva, the home care assistance program was introduced in ASEAN countries, including Philippines, by HelpAge Korea and funded by Republic of Korea in 2003 until 2012. Thank you so much for that. And the programs aims to provide accessible basic health services to older persons, to the community, focusing on the frail, sickly, vulnerable, and living alone older persons by visiting them in their isolated homes or shelters by the nurses, using motorbikes and community health volunteers. So we call it you can see the picture, there is a photo of motorbikes with the nurses. Then the community health volunteers or the home care assistants conduct home visits and provide assistance in the activities of daily living such as bathing, grooming, dressing, meal preparation and eating, taking medication, physical exercise, and doing errands. Next is another is the establishment and promotion of group home. So by the way, group home we established it in 1992. It is a community-based residential care facility for poor, abandoned, and neglected older women. It promotes independent living. The residents themselves manage the home. They plan the menu for the week. They do the marketing and other activities, and they can still do what they want, like going to church, attending meetings of older persons organization, etc. So we can say that they have like the freedom. They are like staying in their own home and with the support of the community. Then we also promote the establishment of Senior Citizens Day Center to provide a place where older persons in the locality can voluntarily engage in social activities or economic activities, income-generating projects, exchange of information, and other activities identified by the older persons themselves. Next is the establishment and promotion of older persons help desk. And I just take some water. So we also started the establishments of help desk and now being promoted to ensure that all issues of older persons are captured, documented, and addressed by the proper agencies or institutions through referral system. And it is being managed by the older persons themselves. Here we formed also a committee within the older persons organization called OCMC, or Older Citizens Monitoring Committee. They monitor the implementation of local and national policies and programs for older persons, report the implementation gaps, and provide recommendations to better implement the policies, programs, and services. Additionally, the formation of support group. This is a group of individuals, organizations, or institutions that join together to provide concrete support or services to sustain the programs or services initiated by the older persons organizations, such as on health, livelihood, socialization, activities, and others. COSE also promotes inclusive community-based disaster risk reduction and management, and this is actually led by the older persons themselves, and inclusive humanitarian response. So this is to ensure that the active participation and inclusion of older persons in all phases of disaster risk reduction and management and climate change adaptation, because most of the time older persons are seen as merely recipient beneficiaries. They are not, being consulted. They are not included in the formulation of programs, services. So that is our advocacy to really promote the inclusion of older person. And also, we introduce and establish an age-friendly and diversified livelihood within older persons organizations, such as a small-scale business and micro-lending. Some, they do goat racing, sewing, and they have communal garden that uses crop diversification and typhoon-resilient farming. We experienced that during the Typhoon Haiyan. Yeah. Then we also, another initiative of our organization is on research and documentation through the establishment and promotion of senior citizens database. We call it Senior Citizen Registration and Information System, or INCRIS, because in the country there is always a problem of data concerning older persons. So different agencies, they have different data or information, so that is why we promote this. What we do, we install the system in our partner older persons organization with the partner local government units in our covered project areas. So they register all the older persons, senior citizens, then the available data, information of older persons are being used for the development or enhancement of policies and programs and services. COSE, through the support of HelpAge International and other partners, donors, also conduct researches and studies. Some of them are the assessment of the social pension program in the Philippines after 4 years of implementation in 2015, and the feasibility study of the universal social pension. The study says that universal social pension is feasible, but unfortunately, since 2015, we are advocating for it, but it's not being passed into law. Then, another is the networking and partnership building. COSE engaged also in this. So we establish some networks or alliances to promote the rights and welfare of older persons, such as Aging and Disability Task Force or ADTF, Action for Pension Coalition or ACAP, and Alliance on Gender in Aging in the Philippines or AGAP. COSE is also a member of different networks at the national, regional, and international levels. So, COSE, as mentioned earlier, we work closely with the Commission on Human Rights in the Philippines. We do advocacy in policy development, awareness and education campaigns, capacity building or development, and research and documentation. Next, for my last slide, for the future direction and recommendation, we want to enhance the advocacy efforts for older persons' rights, improve the delivery of services to older persons, foster stronger partnerships among stakeholders, and offer specific policy recommendations to address identified challenges. That's all. Thank you so much.
Thank you so much. Yet another very comprehensive presentation. So I think that we have a lot of substance already now, but even more substance will be given by Mr. Kaekwanta, who will also talk more about Thailand this time.
Good afternoon, ladies and gentlemen. It's my privilege to be here today. So, as the local NGO and national NGO, we will talk about what about FOPDEF? FOPDEF stands for Foundation for Older Person Development. So we put here is to serve the undeserved. So we don't focus on the human rights. I think not only in Thailand that the national human rights is not raised for, not focus on older people, but other people. For example, like a child and youth, women, people with disability, and vulnerable group. Strangely, older people is included in the vulnerable group. Okay, it doesn't matter wherever it is, but we work for the poor and frail older people. Sorry. So our aim is to improve the aim to work with and for older people to improve the quality of their life. So the field of our work is focused on the capacity building of the older people and the community to work for older people, and also the where the poverty reduction, we focus on the income generating activities, as well as the disaster risk reduction and climate change. And for sure, caregiving, because older people, many of them, when they're getting old, so they need care. So we cannot avoid from that. And thank you for the Republic of Korea and ASEAN Cooperation Fund that support us to run the ASEAN Home Care in 2003 until 2012. Yes. And certainly the rights and entitlement of older people that we focus on. And in Thailand, the National Commission on Human Rights just announced for the CSO to register as a human rights organization, and immediately FAPDEP approached to register, and we just approved last year. And we just had 2 meetings on human rights of older people. The second meeting just last month, so very new on this. But when we're talking about this, we are talking about the poverty and the disadvantaged older people. So let's start from here. HelpAge International support FAPDEP in 1999 with 500,000. That's our asset up to now. But the currency, we use the legal status to raise fund. So we annually we have about 10 or 13 million baht to work with and for older people. So let's start that. We focus on the older people affected by HIV/AIDS because we have the whole or the space family because of the older people and the young people, and the middle people, they pass away because of AIDS. So there's the burden of the older people to take care of children. So from actually FAPDEP start, but the home care from 2005 until 2012, and then we the heavy flood in 2012. So we start disaster risk reduction, and also we get support from the EU to work on the rights and income security in older people. So we carry on that, and for the ASEAN home care, we upgrade that at the end of 2012, and we upgrade that into the what they call the body home care for the better off family, to provide better off family. Okay, let's go to the different. Focus on the human rights of older people. I refer to the Act of Older People or Act of the Elderly in 2003. This Section 11, the elderly shall have rights to access the following protection, promotion, and support. This is the law for the government. So, number one is medical and public health services. Focus on the it's longer than this, but I just shortened it down to convenience and rapidness. So this is something else that we have to improve, because the government said that, okay, in the hospital, they have to have like a green channel for older people when you are ready. And with this, having said this, many hospitals said, I'm not ready, so I don't have green channel for the older people. In some hospital, they said, okay, this is the green channel for older people who are 85 and over. And how many older people at 85 and over attend the medical services at the hospital? So this is the reality. And education, religion, and useful information and news for their living. This is good, because in Thailand they have like a school of older people, and they have the continuous education, and that for good for the older people in the city, in the urban area. But in the countryside, is something else. Okay, and 3, appropriate occupation and or occupation training. This is good for those who decide to work, but not many people want to start a new thing. They want to. Many retired people, they want to stop and do something else. And in many cases, they want to train on this and that, but not the needs of the older people. Or some will say that the business sector hire older people, but the older people, they have self-dignity. They want to be this self-governed or the entrepreneur themselves. So what they should do is to provide opportunity for older people to run business by themselves, not hire them. Culturally, except Singapore, that hire older people. But in, I think, other countries in Asia, because of the custom, if you see the older people work in convenience store or somewhere, and the young people, the adult children will be blamed. You don't look after your parents, something like that. I think more or less the same in this region. Number 4, self-development and participation in social activity. This is good, very good in Thailand. Like OPC stands for Older People Club, or somewhere else known as Older People Association. This is very good for the city, for the big city, that older people getting together to get rid of the loneliness, and they can socialization. But many people cannot join them because of poverty, because of ill health. So what we do is how to empower the OPC or OPA, the active aging, to work not only for themselves, but also to work for those who cannot join the club or association because of poverty, because of ill health, or whatsoever. So this is what FOPDEP is working. It very challenging that many older people, particularly the leaders of the old people club, they said, you can tell me what to do. I can do anything because I have experience. But they rather not think out of the box. They just listen. Okay. So number 5 is friendly facilities, like places, vehicle, or other public services. This is good. That when we discuss this in Bangkok, they will talk about the transport, like the bus, what they call the easy get to the bus. But in the countryside, there's no bus. So, and the people will say, okay, older people don't travel. But if there is the convenience, they will do. And for transport, well, like me, I am older people myself. If I transport and train or have 50% discount. But in the countryside, but the transport between this district and sub-district or province and district run by the business sector, not by the government. So they don't reduce for the older people. Remember that. So as friendly society, for me, it's not only the infrastructure that they are focusing on, like a universal design or something like that. But if the older people with dementia, if they get lost, how can the community be friends with them and they can live freely in community and safely? So this is not happened yet. Okay. In some organizations, they how to find the lost older people. But if you look at the way, how we prevent the older people lost? That the OPC, Older People Club, almost every village, there are more than 3,000 clubs. No, not 30,000 clubs in Thailand. If we empower the older people club to aware of old people with dementia or the older people with ill health, so that's the rights of the older people. Number 6 is appropriate support transport, like I just mentioned earlier, the airfare. So sometimes, for example, like the train, the train cost is not much, but they charge air condition, they charge the sleeping bed, something like that. It's not the fare, but something else. So they have to pay 100%. Okay. Number 7, exemption from entry fee for the government places. This is good. If you go to the zoo, go to the park, or a museum, or anywhere, that belongs to the government. For me myself, I don't have to pay. But if I drive in the zoo, I have to pay for my car. Yeah. So this is good, number 7. Number 8, assistance for elderly person facing danger or torture or unlawful exploitation or abandonment. This is the policy is good, but how to bring the policy into practice effectively is our challenge to work with the older people club. Yeah. Number 10 is number 10? Number 9. Provision of advice and consultation on the other proceeding in connection with case and liability of family problems. This is, they have like the lawyer or give the information to help with poor old people. This is a good policy. And number 10, extensive provision of housing, food, clothing, where necessary. This is related on religion, like the 4 basic needs of the human being. Number 11, extensive and fair provision of monthly old age pension. Yes, this we started about not long ago. Start old age pension. Right now, what we are doing is try to upgrade old age pension or old age allowance. Because right now it's about 1/3, 1/4 or 1/3 of the national poverty line of the old age allowance or old age pension. So very small. So what we encourage or campaign on the at least not less than the national poverty line, which is about, I would say, about 3,000 baht a month, less than $100 US. Number 12, assistance in holding their traditional funerals. This is common there, but they have something like the subsidy for the funerals of older people. That the money for the family, not for the older people. We call after death money. The 13 is something else, like other matter stipulated by the committee announcement. This is general, very general. This is some kind of what existing there, but how to bring this good policy into practice. So my recommendation and to work with other NGOs, particularly when I attend the National Commission on Human Rights, I'm the only NGO sitting there. for older people. Focus on the older people. I'm the only one. So what we say here is, don't wait for the government tell you to work. Don't wait for the government to tell you to work for the older people. But tell the government and the policymaker what to do for the older people. So what our idea is to enhancing financial security for better life in old age. We don't look at for the current older people, but the older people in future. That means the working age group. I myself, over 75, and many of my friends, they have nothing because they don't have. They are not retired people. They have no pension, but they have the old age allowance, 600, 700, 800, and 1,000, according to your age. 60, 70, 80, and 90, and above, respectively. So, what we encourage now is having this is like a job opportunity with fair salary and working age group, in working age group. Because in the countryside, the daily wage for men, for example, maybe 250 baht per day. And for women, is it 200 baht or less. So they can work together. How is the fair rate for the daily wage? Because job opportunity. And the second one is encourage or embed the positive attitude towards saving for retirement. This is very important and very challenging because of what? I'm poor. I don't have enough to live on. Have enough to eat. How can I save? But look, if you save after you eat or you spend, you will have nothing to save. But if you save before you spend, for example, if you earn 1,000 baht and you keep 200 baht and use only 800, that means 20% saved. I talked to the academia. They said 10% is very risk, is not enough. 50% is high risk. So 20% is quite safe. But 20% now and in 20 years is something different. So the challenge is how to change the paradigm to have the positive attitude toward saving.
I must ask you to conclude in a few minutes because
okay,
we are
thank
arriving.
you. So to upgrade the OH allowance that I mentioned earlier to be the universal pension related to national poverty line, not less than that. And strengthen volunteer community-based home care for older people. So this, because when they're getting old, so they will need someone else to take care of them. And develop affordable care services with professional caregivers for older people of the middle income family. They also need someone to help them. And very important here, functionalize the local authorities' long-term care system effectively. So the long-term care is run by the local authority in Thailand. And many local authorities say that, oh, there's small money, there are not many bedridden people, so I don't want to do that because the budget is too small. They manage the budget, but they manage the income. Okay, that's a, thank you.
I don't know what the organizers did by hiring me as the moderator. I've done a terrible job because we are arriving now very close to the hour. But at the same time, I think that my role was very humble to let room for these high added value presentations. Every minute has been spent very, very wisely, and I think that we have all been enlightened by the substance. So I don't blame it too much for not having made room for too many questions, but the organizers have promised me that if the audience would like to ask a few questions in a very short and snappy manner, that would be possible. So, please, sir.
Thank you very much. And because of time constraint, I'd like to try to be very short in asking question. Well, thanks to all the informative presentation made by the speakers from the 5 countries of ASEAN, I could deepen my understanding that all Southeast Asian countries are very serious in addressing this human rights issue of the older persons, and also making a very strenuous efforts to promote the human rights of the older persons. But however, I want to know more about this human rights issue is that how your countries, 5 member countries of ASEAN, are making the collaborative efforts to address your common concern at the regional level. This morning, Deputy Secretary General of ASEAN highlighted how much emphasis the ASEAN put to promote the human rights of the older persons. So I wonder if this institutional endeavor and made by the ASEAN level is translated into action on the ground. And also this morning, and I was encouraged by the remarks made by the Deputy Secretary General that ASEAN has set up the aging center in Bangkok several years ago. So I also wonder how your countries utilize this aging center in Bangkok in reality. And if you have time constraint, and then please make reaction at the final session, and all the member country participants from ASEAN countries can take a part in this discussion. Thank you.
Anyone wants to deliver a 10-second answer?
Let me share with you this, because I just finished the ASEAN project on poverty, elderly poverty and active aging, and what we do is we have this collaboration within the ASEAN framework, where we have SOM HD and also SOM SWAT, and for the elderly under the KL Declaration on Aging, the plan of action and things like that, we are working together with SOM HD to develop the action plan. So in the sense that we are involved, and the consensus, and when we develop the action plans, it is by involvement of all the 10 ASEAN countries before it's been endorsed. So it is already in the pipeline. And in terms of Achai, I'm one of the expert resource for Achai in that sense. So, and each member country will have an expert resource for to be involved in Achai, because Achai is under SOM HD, is under the senior officers of health development for each country. So we have representative that is identified as resource person to the Achai group. So, but not all countries are having the resource person expert. Thank you. That's my short response to that.
Anyone else of please, sir.
Yeah, actually, in ASEAN network, we have ASEAN NGO Coalition on Aging, and registered in 1999. That registered in the Philippines. Yes. So the body is there, but it's something like the empty house. It's an empty house. Nothing happened after that. So when it is registered, so if we bring the issue on human rights on those, and with the government. So the government have some support, but the NGO, we don't get involved in that. I don't know. So, but NGO ourselves, we have the body there. But how? That's the I would say the hardware, but no software. Thank you.
Yes, for the Philippines, as mentioned earlier in my presentation, we are members of different networks at the regional level and even at the international level. So, I think what is lacking is the collective advocacy to promote the human rights of older persons. Because for example, COSE, we were once the focal for the older person constituents in the regional CSO engagement mechanism. So we are working with the UN. And now there is a new alliance formed at the Asia Pacific, the ALAP, Alliance on Longevity in Asia Pacific, where mostly of our members here, the speakers are members. So I think that is one of the platform where we can strengthen the collective efforts to promote the human rights of older persons.
In fact, every year ASEAN has a platform for NGO and NGO. In Somswap, there is the NGO forum that all of us goes to the meeting and give our thoughts on whatever is required. So thank you.
Regarding what are you doing? Actually, we do a lot of advocacy, not just with our government, but also at international forums like UNESCAP, WHO, UN. You mentioned whatever we attend because we give the input, because we cannot do it alone. We have, and the government usually, yeah, they listen, but there is no follow-up. But if there is a mandate from the UN, then they follow it up. And with the government, we do, like I mentioned, we have many policies and programs. Mention whatever policy you need, it is there. But in implementing it, we cannot do it alone. The implementation is still there. That's why we want to ask, how do you do that? How make sure that all these policies and programs become reality and can be implemented by the CSO and NGOs on the ground? It's not easy because many times we have actually we are as NGOs, we are very vocal. No action and talk only at all these forums, international or wherever. It's always talk, but no action. And then what do? Talk again. And here we talk again, and we give recommendation in the hope it will be followed up with our respective governments. But we'll see. So advocacy is no problem.
Just very short. For HelpAge Cambodia, as Emily from COSE have just mentioned, we are a part of ALAP, Alliance for Longevity in Asia and the Pacific, and also a part of working group in some initiative at the regional level also, and we have contributed some of input, include the Kuala Lumpur Declaration on social protection, promote social protection, and others. For aging center, we will explore further, but I think this is new for HelpAge Cambodia. Thank you.
If I continue, probably I'll be thrown out by the organization. So I would like to first of all thank all the 5 speakers for producing so much high added value. I'm sure that the whole of the public will agree with me that it was exactly what we needed. And the CSO, for me, as a European Union civil servant, is a really key issue to work with in all fields of human rights. Vibrant, strong CSOs that come with the strength of in the initiative strength of the private, almost like even coming from the private sector, but also with the altruism, is something that government should not shun. On the contrary, they should see them as assets in improving and making society better. So thank you so much.
Thank you, everyone, for another great session. We will have a very short break until 3:10 when the third session starts. Please enjoy break, and I'll see you very shortly. Thank you.